Hi there, my name is Les. I'm here to show you guys our new BellyBinder for abdominal support. For years and years, hospitals have been giving patients just an elastic abdominal binder following a surgery where they want to protect the suture line, or a hernia patient, or even spinal cord injury patients. So if you're a physician or a patient or a nurse, you've seen a lot of these in your lifetime. What we have done is we've created what we think is superior abdominal support. Basically, when you unroll these things, you're going to find that they're extremely long, and you're going to have to cut these for each patient. I'll show you a few features on it. First of all, we use a lightweight moisture-wicking fabric. Second of all, we've got an elastic piece in here so that even when it's snug, it's still able to move as the patient breathes. This pad right here is actually removable, and it's actually a waterproof foam pad. This is very soft, so it feels really good against the abdomen. It's also waterproof, so if water comes on here, it'll roll right off, as well as if it gets bloody, you can clean it. On the other side, we have a medical grade plastic here, so whenever a patient pulls the brace's handle to get the compression or the support they need, the plastic plates will slide very easily over this surface. So if a patient wanted to wash this device, they could simply remove the pad, put this in a wash machine on a gentle cycle for 10 to 15 minutes, and then let it air dry. After that, you can just replace your abdominal pad here, your belly pad we call it. Let's get the Velcro on there. And so these are for right or left-handed patients. You would put the brace on so that the handle would face in the direction that you want to pull. So if I'm left-handed, I would take this, put it over the center of my abdomen, and I would have the handle facing to the left so I could pull left. I'm actually going to cut this to fit and show you how to fit it for a patient. Now, auto lock feature on it, so if it accidentally gets pulled, you'll want to pull here and push here, because this gap between these two plates here is going to be your cutting guide. So I'm going to put this right over the center of my abdomen. Put the pad right here. I'm going to take all this extra material and I'm going to fold it back. And I'm going to take this plate here and make sure that this handle is sucked up to this lock part. In other words, it's not hanging down like this. So pull on the plate and push here, separate your plates. You're going to use this gap width between the two ends as a cutting guide. So basically, you're going to fold this excess material back. You're going to take the plates, bring them over here and set them down, and fabric coming a little bit past this plate. So I'm going to pinch right here. I'm going to mark this. Take any kind of scissors, and you can cut through this device in about 3 or 4 seconds here. It's very easy. Get rid of this piece. So I've got it cut to fit for me. I'm going to center it over my abdomen, put my elastic here, and then I'm going to grab this piece, Velcro it here, and make sure that this is separated all the way. Just pull this where it's snug. Now, if I want to adjust the tension on this, as I pull the handle, I can actually just pull and it'll auto lock and I can Velcro this off, or I can grab this handle, put a little tension on it, push my lock, and I can pull and find out the tension level that feels comfortable for me, let go of the lock, and then just Velcro the handle off to the side of the belt. That's it. It's quick and easy. Only one size to stock, and a patient can get the amount of support they desire. It'll lock into place there. And then if they're going to sit down, they can easily adjust the tension and then sit down and tighten it back if they needed to. But that's a quick overview of our new BellyBinder, and thank you for logging on to view it.